Expert Talk for the month of July. On behalf of Circa, let me welcome Dr. Salil Bhargav, Professor of Respiratory Medicine, MGM Medical College, Indore, who would be speaking on how air pollution is a serious health hazard for us from a doctor's perspective. Welcome to the Circa Talk series, Dr. Bhargav. Dr. Salil Bhargav is a very well-known pulmonologist and respiratory medicine specialist based out of Indore city, with over 28 years of experience in these fields. Dr. Bhargav currently practices at the Gyanposh Research Center for Chest and Allergy Diseases in Indore. And Dr. Bhargav completed his MBBS from MGM Medical College in 1982 and his MD in Pulmonary Medicine from the same college in 1994. Dr. Bhargav is a member of the editorial board of Lung India. He's a co-chair of collaboration to eliminate TB among Indians and is also working for TB Free India. Dr. Bhargav is a fellow of the National College of Chest Physicians, Indian Medical Association, Indian Society of Critical Care Medicine, Indian Society for Study of Lung Cancer, and a life member Cardiology Society of India. Dr. Bhargav has published several articles and chapters in various national and international journals and books, and is also a recipient of the President's Trophy for Anti-Smoking Campaign in 1988-89. As we all know, air pollution is the largest environmental risk to human health and is linked to a range of health, economic, and societal impacts. There is considerable scientific evidence on the health effects of air pollution in India, especially the impact of PM2.5. Globally also, PM2.5 has been found to be the most consistent predictor of disability and death. Exposure to air pollution is also linked to several non-communicable diseases, including respiratory, cardiovascular diseases, lung cancer, diabetes, and several other infectious diseases. In India, more than 1.67 million deaths have been linked to air pollution. And there is also a growing evidence of the impact on health due to air pollution, including learning difficulties, loss of IQ, autism, dementia in older people, and a higher risk of suicide, depression, and anxiety. And also, most recently, increased risk of COVID-19. A recent study reported that indoor air pollution is a risk factor for cognitive impairment among older adults in India. So all the evidence points to a strong association between exposure to PM2.5 and mortality, even below the WHO standards. Thus, no level of air pollution is without risk. Only stringent air quality standards can help improve the population health. But despite the strong evidence that tells us that air pollution is really harming our health, we still don't really realize and appreciate this fact because air pollution is not visible to us directly. Now let's hear what Dr. Salil Bhargav has to say on this important fact. He would be speaking on why and how air pollution is really a serious health hazard and how it is harming communities on a daily basis from a medical practitioner's perspective. So over to Dr. Salil Bhargav. Dr. Bhargav.
Thank you, Hemanji. Thank you very much for your kind words and an excellent introduction about the topic. And thank you for the kind words for me also. Is my slide clear? Are they visible?
Absolutely, Doctor.
Oh, great. Thank you. So I go ahead with this. And
Yes.
I thank you to the team to invite me as a speaker here for this very, very interesting topic. I'll call it interesting because, as you rightly said, the problem is not visible, but it is still hitting us very hard. Yeah. Before I start, let me share a small story with you because it will make more interesting to talk then about all these issues. I had a guest yesterday from Switzerland. They were sitting with us and I was talking to them what is the difference between India and Switzerland. Switzerland is a beautiful city, no doubt about it. We were talking of various things, technology and other things, health systems. Health systems in India are very, very excellent. Believe me or not, although there is a lot of space for improvement, but still, if you want to get a sonography, if you want to consult somebody, it can be done in next 1 hour or 2 hours. but to reach to a expert in European countries, America, it may take from days to months or weeks to months. But in India, it's quite comfortable. What is difference? True difference between, I asked them, what is the difference? Oh, I cannot tell you. They told me, we are not able to use ACs very frequently in Switzerland, although the temperature is quite high. We are not able to use fans very frequently. They are very much concerned about the pollution. So that is one of the important thing which makes India and other countries different from each other. The pollution levels are slightly, not slightly, quite high in India as compared to other people. But is it a really a concern to us? Yes, it is a concern to us. And in next 25 to 30 minutes, I'll be talking mainly about the health hazards, because they are the only thing which one should know why we are concerned. And I understand those who are guests here, I welcome them all. And those who are listening this program, they are already aware of so many things. It will just be a sort of revision with you. So I'll be starting simply by saying, this is one of the news. This is not the true news. This was a few years back. Madhya Pradesh ki hawa sabse zyada pradushit. Now it's not really like that. Indore is now a very clean city. It's a beautiful city. But once it is there, it is in the papers. It is in the news. Everybody looks nowadays very frequently. So what is happening? I am going to talk in next 25 minutes, as I told you, about air pollution and its impact on the health. So it's a major problem in the world today is the air pollution. Its impact on the climate change and its impact on public and individual health. It is hitting our health, no doubt about it. It's a risk factor for increased morbidity and mortality. We are falling sick more frequently. Most of our deaths may be correlated with this increasing air pollution. So air pollution is an undesirable change in the quality of our environment that adversely affects human life, our property, trade, commerce, industries, and life of the desired species of plants and animals. It's not only troubling us, the plants and animals are also in the trouble because of that. Air pollutants can be solids, liquids, gas, present in atmosphere in such concentration as may be or tend to be injurious to humans, other living creatures. When we talk of humans, I am always concerned about our pets and animals who are also living with us, plants, properties, or the environment. And so air pollution, presence of pollution, pollutants in atmosphere, it is there. So this table shows the major risk factors for and their impact on morbidity and mortality worldwide. What are they? And you will see that diet is one of the important factors. Hypertension is important factors. Smoking, certainly active environmental smokeless. Elevated fasting blood glucose level. We are consuming a lot of glucose and sugar nowadays, but certainly air pollution by all means is, again, you can say in global ranking, it is 4th or 5th important major risk factors. Because when we start talking of health, when we start talking of moving forward, as I told and talked about Switzerland, why people want to go to such places where pollution is less, because that increases their life expectancy, that increases their age, and it keeps them healthy. It doesn't hit them. So certainly everybody is concerned about this. That's from air pollution. This may be slight, this is way back, but still in India, it is quite hard to have pollution here in India. Then estimates of deaths and disease burden associated with air pollution, with COPD, and with this may cause deaths because of COPD, ischemic heart diseases, as while the topic was introduced about the ischemic brain diseases, respiratory infections, lung cancers, type 2 diabetes, cataracts, so many diseases can be there because of environmental air pollution and household air pollution. The ambient air pollution and related unnatural death. Somebody has tried to calculate it. It is very difficult. We have been planning to do some study so that we still can understand what is happening in our cities, in our countries. It's although difficult, but it shows that there are a lot of deaths which can be correlated to pollution, air pollution. We all know, as I told you, that most of you are already aware of or working for air pollution or some way concerned with the air pollution control and other things. Vehicles are one of the major vehicle exhaust is a major cause of air pollution. Biomass is again, then soil and road dust is up to 20%. Industries are coming up, we can't help it, but they are known to cause air pollution. Open waste burning, diesel generators, power plants, they are some of the major sources of air pollution. Apart from this, there are few more things which are there, but we should remember, because whosoever is working, as in Indore, we are working for air pollution. So we should have a list from where we should start beginning our work. Vehicles, certainly we can do something and other things can be there. I'm not going to talk much about how we can reduce it because it's not my agenda today. So let us talk about what are the pollutants exactly. Before I take you to the health hazards, the primary pollutants and secondary pollutants. Primary pollutants are emitted directly into the atmosphere from industries, thermoelectric power plants, and motor vehicles. And those by the power fuels, they are the particulate matters, carbon monoxide. And the secondary pollutants are after chemical reactions, whatever comes out, or after photochemical oxidation, nucleation, and condensation. So after some reaction or that, whatever is coming out is there. And it has been well introduced. Particulate matter size 5 micron, 2.5, 10, because the smaller is the size, it is easy for it to reach to the bottoms of the lungs. When I will talk about the health hazards, I will be speaking or focusing mainly on the respiratory part. I'm a pulmonologist, although I will be talking slightly about few more things. But the direct portal of entry of the air pollutants is through nose to the trachea and airways and to the lungs. And from there, then it is absorbed in the blood. It may affect eyes and skin also, but that is the part of entry from where it can reach to the various parts of the body. So it can be of various sizes, and depending on the size, it is more difficult or more easy for it to enter into the body. And the composition of particulate matters, there are so many chemicals and elements which are there, metals and elements. I'm not going to read them all. Then there is secondary aerosols, gases, they all are there, and we all know very well about them. There are multiple things. When we work on a special particular thing, then we can discuss in detail about those things. But this was about the outdoor pollution. But we spend around 40 to 50% of the time in indoor or our house or our homes. Females, elderly population, children, they spend quite a good amount of time while living in their homes or house. And the pollution in indoor areas are equally important. The airborne particles, diesel exhaust, if there it is there because of some reason, carbon, black, dust, smoke, fibers, plant matter, air, pollen, household odors and gases, cooking odors, fat smells, cigarette smoke, passive cigarette smoking, chemicals, drain smells, volatile organic compounds, paints, glues, varnishes. This happens. And sometimes the patients lend to us, sir, we were comfortable few months back. Suddenly we started getting some work in our home and now I have some attacks of asthma and other things. So paints and glues are known to cause such type of things. Then certainly microorganisms, if the atmosphere or the floors are humid, then there may be bacteria, mold, yeast, mites, and virus. They can also be there. So lot of things are there. You have to be alert. Indoor air pollution can be there. When you have carpets in your home, when you have curtains which are made of cloth, they may also absorb dust. And certainly because of dust mites and other things and air polluting agents can be there, which can be released later on. Again, the sources of indoor pollutants, bathrooms, mold, odors, other microbiological pathogens, air conditioning units. As the temperature of earth is increasing, we have been using air conditioners very frequently. In India, every year you will find the consumption of electricity is increasing because of more use of air conditioners. They are unable to remove pathogens and odors circulates without ventilating rooms. Then the living rooms may have different types of pollutants in our house. Kitchen, certainly It will have a lot of them. It may be their fuel oil cooking devices, laundry loom will have, the bedrooms will have, and then we send it outside, few of them, if we are throwing them out. So there we know the sources of indoor pollution. We know where are they and where they are hitting most. So if we are spending a lot of time in our homes, we have to be alert, taking care of our family, our seniors, our children, that we are not exposing them to these air pollutants continuously. So indoor air pollution is equally dangerous. Now coming to the actual business, the topic which has been allotted to me, why and how air pollution has an impact on health. What are the mechanisms? I know you may not be interested into it, but if you understand for a moment, then it will be slightly better to understand what are the health hazards actually. The damage caused by particulate and gaseous pollutants depends on inhaled concentration of the pollutants. We all know this. Higher the concentration, more are the hazards. The defenses of the respiratory system. This is very, very important. If your defense system of the respiratory system is anyhow affected, say because of respiratory diseases which are already there, interstitial lung disease, bronchitis, rhinitis, then the solubility of gaseous pollutants, if it is more soluble, it can enter very quickly in the body. And the possible mechanisms by which they can affect our body is by inflammation, oxidative stress, RONS, inhaled environmentally persistent free radicals. So all they can be there, and reduced function of regulatory T lymphocytes, which are our bodyguards, increased IgE levels, increased production of CD4 and CD8 lymphocytes, along with a greater Th2 response to stimuli by antigens and pollutant environments, leading to rhinitis and asthma. So these are the mechanisms by which it can pathologically hit our body. This slide is the most important of my slides, although I will be talking of respiratory system in detail because that is the point of entry. But this says or shows how different parts of body are involved with the air pollution. In respiratory system, we can have rhinitis and asthma very frequently. I'll be talking in detail about this. We can have pneumonias and infections. We can have chronic obstructive pulmonary disease in which the airways are involved. We can have lung cancers because of the carcinogens which are present in the air pollutants. And finally, it can lead to increased deaths. So all these things can be on the higher side in persons who are living in cities, countries with higher air pollution levels. Then there can be insulin resistance. Type 1 and type 2 diabetes incidence will increase in such type of cities and countries. Changes in the bone metabolism can be there. Blood pressure, and related to this because of endothelial dysfunction, increased blood clotting and systemic inflammation, they all will lead to increased blood pressure and cardiac disorders, cardiac arrhythmias and heart attacks. They all can be there. We are not able to prove them exactly, even because they are not directly hitting it, indirectly because of their effects it does it. Then cerebral ischemia, impact on neurological development or mental health, neurodegenerative disorders, memory, they all are the part of brain. And as the brain also gets the same blood with air pollutants which are entering into it from the lungs, it will have its effect here also. Then incidence of deaths because of cardiovascular diseases. After hypertension, the patients have myocardial infarctions, arrhythmias, and heart failure, which I've talked just now with this. They all can also be there. Skin is certainly affected by effects of exposed air pollution causing early skin aging. When we talk of pregnant ladies, I will be talking in slightly in detail about all these terms. There can be preterm births, low-term weight. There can be reduction and delay in the fetal growth. We don't know what is happening, but it is happening because of air pollution. Poor quality sperm can be leading to infertility, and pre-eclampsia can also be there. So these all things can be there. So now I will be talking in slight detail about the effects on the respiratory system and chronic exposure. It's not acute exposure can also cause some of the problems, but certainly the chronic exposure is going to lead, the patient is bound to have all these things. So overall mortality from respiratory diseases, increased incidence of asthma and COPD, increased incidence of mortality from lung cancer, reduced lung function. You may not understand it, but you may feel tired slightly earlier. Why people from other countries who don't have much air pollution are so fit? They are fit at the age of 70 or 80 also. They can climb upstairs, they do a lot of trekking, they go to the mountains. Why can't we? We means the persons who are living in India with the cities with higher air pollution. We have less lung function. Lung and cardiorespiratory functions are very, very important for our day-to-day activities. Deficit in lung development during childhood. If a child is born from a mother who has been exposed to air pollution, the lung development of that child has been affected since early childhood, and naturally it is going to be visible later on. We have talked of lung cancers, cardiopulmonary events also. Respiratory infections, we have all seen COVID very well. And COVID was one of the severe forms of respiratory infections, what we have seen. And with air pollutants exposure, the risk of upper and lower airway infections are visible. Exposure to particulate matters was responsible from deaths from respiratory infections globally, children, elderly, increase in pneumonia events, and increase in NO2 exposure related risk of pneumonia. So you may not come to know why this infection is coming in this person, why it is happening. Every time a patient comes to me with pneumonia, I try to find out, although I'm not able to show exactly is the air pollution a responsible factor, but we can plan some study. If somebody is coming from a particular area, geographical location, what is the status of air pollution in that area? Is it responsible? Maybe. We have seen current studies suggest that SARS-CoV had some relation with air pollution level, and exposure to particulate matter would have contributed to 15% to global COVID-19 mortality, being an important cofactor for increasing the risk of COVID-19 mortality and morbidity. So although that dream or that bad dream or the bad time is over, but if we look retrospectively, those persons who were living in the area badly affected with air pollution might have poor lung reserve, and that might have had harder impact of COVID-like infections to their lungs and to the body. There may be some supporting pollution-related factors for respiratory infections, age, asthma, COPD. If already they are existing, these patients may have more respiratory infections, and certainly extrinsic factors like poor socioeconomic status, living closer to industrial areas, living in overcrowded household, areas without appropriate green spaces, diets poor in fruits and vegetables, which have a lot of antioxidants, vitamins. So if somebody is having all these things and some intrinsic factors, certainly they may have more chances of respiratory infections when they are mixed with air pollution. Rhinitis is one of the things we see nowadays. Very frequently people are coming. In my practice, they come, sir, I'm having rhinitis most of the time of the year. And when you ask in which area do you live, so it may have some correlation if you inquire from them. So exposure to various particulate matters may have a, particularly in children and adults, and then asthma may have impact because of gases which go inside the body from motor vehicle traffic related air pollution. So not only the progress of asthma, but exacerbations, hospitalization, and deaths may be visible on higher side with patients with asthma. So air pollution is associated with increased incidence of asthma everywhere in all age groups, but particularly with children and in elderly. COPD, I've been talking to a good number of politicians to talk about COPD. They say, what is COPD? Doctor, what is COPD? I don't know. COPD is fourth major killer at present, and it is chronic obstructive pulmonary disease. And with increasing air pollution, there are increased number of exacerbations, emergency room visits, hospitalization, deaths. They all are because of COPD. Certainly, the air pollutants, they may have some pro-carcinogens and carcinogens which can cause increased risk of lung cancers. Air pollution may have genotoxic effects, DNA adducts, breaks in DNA strands, damage to DNA, and they may have even direct and tumorigenic effects. So directly or indirectly, there is no doubt about it that air pollution is responsible for development of multiple cancers, but especially it is responsible for increasing number of lung cancers, no doubt about it. Pregnant women is one of the sensitive periods when they are more sensitive or prone to have multiple problems, but they are also carrying one baby or one fetus inside their body. So its growth restriction may be there. It may be in early delivery. The birth weight may not be good, which may later on create problems for him. There may be congenital anomalies. Intrauterine and perinatal deaths numbers may increase because of air pollution. So it is because of, technically, it is because of placental inflammation, abnormal trophoblastic invasion, and decreased placental angiogenesis. And so it may lead to different types of problems with the pregnant ladies and the children. With children, 93% of the children, they live in highly polluted environments. It has been found, particularly in developing countries. And 1 in every 4 deaths of children under 5 years of age is directly or indirectly related to environmental risk. So less than 5 years of age, they may have different things. They may have a high minute ventilation. They may have higher basal metabolic rate. They are engaged in more physical activity than adults. They are spending more time outdoors, and their immune system is not fully developed. So the children may have more effects because of air pollution. So we have to be little alert while the children are there in polluted air pollution cities. Certainly the other extreme, that is elderly population. It may again have some problems. A less efficient immune system is there in these elderly persons. This is, we all know, as the body grows up, the immunity goes down. There is a progressive decline in the lung function.
It is the highest ever.
The best lung functions are at around 25 to 30 years of age, and then it starts declining. But certainly in elderly population, so there is, we know that there is a decreased exercise tolerance. You ask them if they are not doing regular exercises, cardiopulmonary specifically, they will not able to move fast. They will not able to climb up stairs. They will not able to carry some heavy weight because their lung function is declining now in this age group. But with air pollution, there is a further problem. It multiplies the problem of immune system and their lung functions and their lung resistance, their airway mechanisms. It further decreases. There is greater increase in hospitalization for air pollution related pneumonias. You will find that pneumonias are very common in elderly as compared to the younger age group. And it's not the numbers are common, but it is slightly difficult to treat it also. And similarly happens with diabetics also. So elderly with diabetics, elderly have multiple issues, comorbidities we call it, like COPD, they may have asthma, they may have interstitial lung disease, they may have diabetes. Now, good number of patients with organ transplants are coming in. So lung transplant, liver transplant, kidney transplant, these patients are there who are on immunosuppressive therapy. So their problem is multiplying with exposure to air pollutions. And ozone and fine particulate matters in different seasons, it may be responsible for an increased risk of all-cause mortality among elderly individuals. So when we take care of elderly individuals, we should see that can we decrease the air pollution around the areas where they are living? Can we make them safer? Can we vaccinate them? Certainly, vaccination with elderly pneumococcal vaccinations, influenza vaccines, this should be promoted now in senior citizens, because we cannot decrease the air pollution overnight, but we can increase their body immunity, their body resistance to combat with the air pollution. So the estimates of deaths and disease burden associated with air pollution. So air pollution and different diseases, pollutants and diseases which are there, they are on higher side. It is because of environmental as well as household air pollution. We see COPD patients are on higher side. The highest one is COPD. then ischemic heart disease, brain disease, respiratory infections, lung cancers, diabetes, cataract, skin problems, and certainly the age, our longevity of life is also affected because of increasing air pollution. Although in India, the age expectancy has increased from 60 to 70, 75, now it is gradually increasing. But there are different reasons for that. Cleanliness, better health facilities are there. But still, if we can do something for air pollution, if we continuously work for air pollution, and if we can decrease it, it will help to decrease incidence of all such diseases which are associated with air pollution, and the life expectancy may further increase. Sometimes a question is very commonly raised, can we do some exercise? This may be a case, yeah, it is from Delhi. So air pollution is there. Can we still do some exercises which may not harm us? Yes, a healthy individual can take up some exercises, even there are some polluted spaces. I've not talked in detail about how we can keep our health system stronger. Although, as I told you, we cannot control air pollution overnight, although we are working on it. But as a doctor, I work to increase the body resistance, the body immunity, the body strength to combat, even if you are working in areas where there is very high air pollution. So exercise is one of them, and particularly doing some cardiorespiratory exercises. You can do it even for individuals with chronic diseases. Mild to moderate exercises in polluted environments, it doesn't harm them if the pollution levels are not very high. And in the same way, we have to do all these things. And exercises apart from this, yoga practices are very good. Particularly the pranayam, we should do at least spend 10 to 15 minutes for this. And we should do some cardiorespiratory exercises. If somebody is going in the gym, he can do all those exercises also. Upper chest strengthening exercises. There are various types of asanas which can take care of your upper part of the body that controls or that is associated with chest movements, apart from muscles of the legs also. So if you are doing those exercises, I find yoga is a very useful method of improving our body immunity, body resistance, and combating day-to-day problems like infections, air pollution, and other things. So this is one thing. And apart from this, we should also take care that we are consuming enough vitamins. We have been finding that good number of patients who are coming to us who are very sick, their vitamin D on estimation is less or on lower side, which may be responsible for their health hazards. So if you can do something, you can take vitamins, vitamin D, vitamin C, multivitamin, sprouted things, sprouted edibles. I know all of you know about this very well, but just to complete, for the sake of completion, what else we can do? So the exercises, yoga, diet and nutrition, and certainly we should do something when there is a dark night, the trees are not good, but still there is a tree which is there, which is giving you pure oxygen and taking away all the carbon dioxide. We should plant more and more trees as possible, whatever best we can do. And I thank all of you for staying with me and for saying no to pollution. It's not air pollution only. I'm concerned about air pollution, certainly water pollution, noise pollution. These are all which are taking away our health and making us uncomfortable. So I salute all of you for doing good job for taking care of air pollution and other things. Thank you very much. I stop here, and if there are any questions or something, some comments, you are welcome to say about that or ask that. Thank you very much.
Thank you, Dr. Bhargav, for a very insightful presentation and sharing your knowledge, experience, and thought with us. So now moving to a Q&A sessions, we have a couple of questions from our participants. So I'll read it for you.
Yeah.
So our first question is from Rishi Raj. So the question says, what are some proxy or passive indicators of pollution exposure, because active sensing of exposure level isn't easy since not every human cannot carry a pollution monitor with
Right,
his or her.
right. So the some proxy or some passive indicators, uh, early tiredness, you can call it the features which we see in aging. You can see aging means what? You feel tired, you are not happy, you are irritable. The psychiatric illness, you are irritable, you are shouting at somebody. So if somebody is living in an area where there is high pollution, and if these things are there, and you have excluded other disorders like hypertension, some psychiatric illness, cardiorespiratory illnesses, then they can be the early warning signals. So we should be very careful about that. One has to look beyond what doctors are looking. So we have to think about that. It's not that easy. Your question is very pertinent. Can somebody look at it? Yes, somebody, persons like us who are working in the field of air pollution and its hazard, we should say something. We should make people aware and make aware to the society that if you have these warning signs, early signs, irritability, early tiredness, aging process, skin changes, early disorders, which should not occur in an age group. So we can think of such things. Thank you.
So our next question says, sir, is there any evidence that different lobes in the lungs, right or left, may have a different level of pollution disposition? For example, I have read in one of the research article that right lower lobe can have more chances of getting lung cancer. What's your idea on this?
Uh-oh. Uh, I'm not sure what exactly is your meaning of which part of the lungs can have more effect because of air pollution, if it is right. As far as I know, the right airways are, or the right tracheobronchial tree on the right side is slightly straight as compared to the left one. So we usually are aware that if something goes while we are talking some foreign body, there are more chances of going it on right side. I know that, but I'm not sure on what side there will be more chances of effects of air pollution on right or left, and more chances of lung cancers. It can affect, as far as I understand, I'll check it again. As far as I understand, both sides of the lungs can be equally affected by effects of air pollution, or whenever lung cancer is developed, it can affect equally both sides.
Okay, so next question from Soumya. The question says, is there any research happening on other pollutants you spoke about, whether bioaerosols or metals in ambient air? These are the next level pollutants which are going unmonitored in ambient air, and everyone has been focusing just on dust. Please throw some light in institutes where such research is happening.
I'm not sure if somebody is there in our audience who can answer this. I'm not aware of the areas where such type of researches are being taken, because they are slightly high-end thinking process. As far as I know, I've met the IIT team Delhi. They have been doing a lot of research work. Dr. Kaushal, I don't know if somebody can answer this. Not sure, or otherwise we will find out and we can answer Somya later on. I'm not sure.
Okay, so our next question from Dr. Kripa Ram from BHU. The question says, how medically you will ensure that problem is due to air pollutants only, not something else?
Oh yeah, this is a $1 billion question. We call it like that. That is the thing, because we cannot see the effects, direct effects of air pollution. We are not sure what is happening, but we know this thing. As I told you, we are trying. A lot of studies have been done in Western countries, European countries, the effects of air pollution. But it is very difficult to separate it, because multiple things are overlapping. It's a multifaceted issue. So it is very difficult to say that it is because of air pollutants. Nobody agrees with that. In fact, if you go to the government and say like that, they agree with this, that the air pollution is harming you, but this is only because of air pollution. Acute things, yes. Acute things means, suppose if there are some gases, chlorine leak is there, some acute problem is there, nobody will deny that. But when chronically when it is there, you cannot prove it easily. You cannot prove it easily until and unless you monitor a group of persons and their level of exposure to the pollutants and the diseases which are developing as compared to a control group which has not been exposed to the air pollution and what disease they are developing. So until unless it is done, it is slightly difficult to say that this problem is because of air pollution. I fully agree. This is a very difficult question to be answered.
Okay, sir. So next question is, how can we connect climate change with air pollution if climate change is directly impacting human health?
I think I'm not a environmentalist, so I cannot answer that exactly. But it is very interesting to see this time how badly the rains are hitting not only in India, but the weather conditions which are happening and changing all over the globe. We all can see how bad is the rains, how bad sometimes the fire problems, and a lot of things are happening around hilly areas also. So somewhere it also affects air pollution. Climate changes will be there because air pollution, it increases the temperature of the earth, temperature of the environment, and then the things which are associated with air pollution can do that. I don't know whether somebody from IIT team can answer that. If somebody is there, then probably they can answer it. I will be happy if somebody can help me out.
Okay, sir. So next question is on air purifiers. There are different air purifiers in the market, but many people are not aware about the product and the benefits of it. People are not still not buying those unless they are face acute or chronic disorders. What can we do to create an awareness so that they tend to buy those?
Oh, so now this is coming as one of the answers. So we first create air pollution and then we ask the persons to purchase air purifiers. My point is that I'm never in favor of asking to use air purifiers until and unless it is a situation like Delhi. In Delhi, it was really bad and there they need it. But in Indore, I may not need it. Air purifiers, they can purify a small area. It's not that easy. It can purify, if there are bigger machines, I'm not sure about that, then they can take care of a big office and other things. So if in a company or in an office, in an area, if the air pollution levels are going quite high, above alarming levels, and patients are coming with different health problems, then as one of the solutions, those who can afford can purchase and they can use air purifiers. How much they are effective, how much they are cost effective, it is still a point of debate. But I feel, Sukhdevji, yes, it is one of the answers in future, but still, why can't we put a lot of plants in our house? In spite of a plant, we should really, green plant can be put at the home. So that can be a better answer. Try to decrease use of vehicles, reduce use of ACs and other things. If that can be tried, you are saying, how can we convince them? People are convinced. They don't need to be convinced. They in fact ask for some support or what can be done because their child is continuously coughing, getting recurrent infections. Then they may ask you, and then the doctors, the agencies, the NGOs can help them to understand what is the role of air purifiers and how much it may be effective. Nobody's sure about that.
Okay, sir. So our next question is from Dr. Bharat Jain. So he said, it is said that contribution of air pollution from industries is 25%. However, rest is from domestic areas like vehicles, etc. For industries, we install air pollution control devices, but at domestic front, it is still a question. Please comment.
Absolutely, you are very right. And although you are saying that we do something great for industries, but still there is a lot of space for doing in the industries. We should do something more for industries. But at home, the domestic front, a lot of things are being done. A lot of things. The gases, the cooking gas has been used. Uh, Different types of biofuel or bio gases are being used in the villages also. So they are trying to do it. And apart from this, what has been answered is as air purifier awareness, the same has to be done for domestic air pollution. We cannot control air pollution by machines at home. Air purifier can do up to some extent, but we have to reduce the levels of air pollution by making the people understand them. While a doctor is talking about, when we talk about a patient about asthma and COPD, we ask them what fuel you are using at your home. And that is the point where we can do something for them. Please change your method. So this is one of the ways by which we can do up to some extent.
Thank you, Dr. Bhargav. So in the interest of time, we will not be able to take all the questions here. So I request participants to post our questions and we will post it directly to Dr. Bhargav for his comments. So moving to our formal vote of thanks part. So I on behalf of Sarka, want to extend my sincere thanks to Dr. Bhargav for accepting our invitation to deliver this expert talk. And it was real pleasure and honor to host you as our expert speaker this month. And finally, I also want to personally thank all the participants representing from different sectors who took time off for attending this talk and making this session interactive through Q&A. So we will announce our next scheduled talk via email and social media's handle very soon. Thank you so much. See you soon. Thank you.
Thank you, Dr. Bhargav, for the talk. It was an
Thank
excellent
you.
talk, and thank you everybody who joined this talk. Thank you once again.